This is a pre-recorded lecture for Delaware County Technical Schools LPN program, Chapter 30, Oxygenation. We are first going to review the objectives of the chapter as stated on page 799 in your textbook. The first objective, describe the structure and function of the cardiopulmonary system. Second, identify the physiological processes of cardiac output, myocardial blood flow, coronary artery circulation, and respiratory gas exchange. Describe the relationship of cardiac output, preload, afterload, contractility, and heart rate. Diagram the electrical conduction system of the heart. Identify the physiological processes involved in ventilation, perfusion, and exchange of respiratory gases. Describe the effects of a patient's health status, age, lifestyle, and environment on tissue oxygenation. Identify and describe clinical outcomes as a result of disturbances in conduction, altered cardiac output, impaired valvular function and myocardial ischemia, and impaired tissue perfusion. Identify nursing interventions for promotion, maintenance, and restoration of cardiopulmonary function in the primary care, acute care, and restorative and continuing care settings. And lastly, identify and describe clinical outcomes for hyperventilation, hypoventilation, and hypoxemia. We are now going to talk about the cardiopulmonary physiology, and we know that oxygen is a basic human need and that it is required to sustain life. So the function of the cardiopulmonary, when we talk about cardiopulmonary system, cardio, heart, pulmonary, lung, is to provide oxygen to tissues and to remove carbon dioxide and waste from the body. The primary function of the lungs includes ventilating or ventilation, which is the movement of air in and out of the lungs. And also for diffusion, which I know you learned in anatomy, and this is specifically with the cardiopulmonary system, the movement of gases between air spaces and the bloodstream. Respiration is the exchange of oxygen and carbon dioxide during cellular metabolism. And the heart supports perfusion, which is the movement of blood into and out of the lungs to the organs and tissues of the body. We're going to now review the structure and function of the pulmonary system. This picture is on page 800 in your textbook if you wish to find it later. So this is the structure of the pulmonary system, and it consists of two lungs, their airways, the chest walls, and the blood vessels that support them. The right lung is made up of 3 lobes, while the left lung is made up of 2 lobes. And the way to remember that is the heart is on the left side of the body and takes up some space, therefore there are only 2 lobes on the left side, 3 lobes on the right side. On the right side, with the 3 lobes, we have the upper lobe, the middle lobe, and the lower lobe. And on the left, that just has 2 lobes, it's the upper lobe and the lower lobe. The trachea comes down and enters the thorax, and it branches out into a main stem or a bronchus. So we have a right main stem bronchus, as you can see on your picture there. The bronchi branch into smaller and smaller bronchioles, similar to a tree. And the last branch of this airway is where the exchanging unit of gases occurs in the lungs. What we talked about before, this is where the alveoli are. So the blood flows around the alveoli, allowing for diffusion of oxygen and carbon dioxide. The alveoli are lined with something called surfactant, and surfactant is a phospholipid-rich substance that prevents the alveoli from collapsing or turning into that raisin on expiration. Surfactant is absolutely essential for normal lung function. We are now going to talk about the function of the pulmonary system, or the functions of the pulmonary system. First is regulation of ventilation. And ventilation during this process, control of ventilation provides for adequate oxygen to meet metabolic demands so that exercise, infection, or pregnancy can occur. So it is very important for ventilation to be appropriately controlled. The central nervous system is what allows ventilation to be controlled, and the central nervous system sends signals to the chest wall musculature, the muscles within the chest wall, to control ventilation rate, so how many ventilations per minute, the depth, is it shallow or a deep breath, and also the rhythm, so is it that normal rhythm that we discussed last week. Next, we move on to oxygen transport. And while I'm talking about oxygen transport, you can turn to page 801 in your textbook and look at figure 32. It's a great picture of diffusion. So oxygen transport, this is the delivery of oxygen, and this depends on the amount of oxygen which is entering the lungs. Ventilation allows for movement of oxygen and carbon dioxide into and out of the lungs. Once oxygen has reached the alveoli, or those grapes, diffusion can then occur. Oxygen crosses the alveolar capillary membrane and is dissolved into the plasma. It then moves into the red blood cells. Hemoglobin transports most oxygen and serves as the carrier for both oxygen and carbon dioxide. So it is very important for us to know this, that hemoglobin transport most oxygen and serves as a carrier for both oxygen and carbon dioxide. So therefore, if I have low hemoglobin, I'm going to have low amounts of oxygenation. Perfusion of oxygenated blood occurs in the capillary beds of the organs and tissues. And again, perfusion is when the blood is perfused or sent to other organs and tissues of the body. Then we get into carbon dioxide transport. Carbon dioxide transport, so there's a lot of information in your book, and if you can just understand what we're about to talk about in just a minute, that's what I want you to take away from the carbon dioxide transport. So once carbon dioxide is transported by the venous blood to the lungs, so the blood that gets sent to the lungs during the circulation of the blood, diffusion occurs again. So just know that the carbon dioxide rich blood goes back to the lungs, diffusion occurs again, and we then have oxygen rich blood again. The carbon dioxide is highly soluble, and it quickly crosses the gas membrane into the alveoli. So through ventilation, carbon dioxide is expelled from the lungs and into the atmosphere. So we know that the oxygenated blood gets carried out to the tissues, deoxygenated blood, or blood saturated with carbon dioxide, gets returned to the lungs, down to the alveoli, and the gas exchange occurs again, or the process of diffusion occurs again. The blood then becomes oxygen rich, and the cycle starts all over again. This is just a closer look at the alveoli along with the capillaries. Just a closer look there. This next slide is, if you go see number 1, is an example of the deoxygenated blood coming through the pulmonary circulation, and the little piece up top there is the alveoli. So we're going to just see the process of the deoxygenated blood become oxygenated. So number 1 is the deoxygenated blood. Number 2 to the right top corner is when the CO2, or the deoxygenated blood, then goes into, or the CO2 goes into the alveoli. Number 3, within the alveoli is where the gas exchange occurs. So this was the diffusion. Number 4, this is where the O2 goes then into the circulatory system. And number 5, this is where the oxygenated blood then gets perfused to the tissues and organs. Some factors affecting oxygenation include hypoxia, hypoxemia, hypoventilation, and hyperventilation. Hypoxia is inadequate tissue oxygenation at the cellular level. Some causes of hypoxia include diminished concentrations of inspired oxygen, as in high altitudes and airway obstruction. So, for example, the air that we are breathing in has a decreased amount of oxygenation in it. Another example would be obstructive or restrictive diseases, such as COPD, chronic obstructive pulmonary disease, in which the airways in the alveoli lose elasticity and become inflamed, not allowing adequate airflow. Some signs and symptoms of hypoxia include tachycardia or increased heart rate, peripheral vasoconstriction, dizziness, and mental confusion. Treatment may include cardiac and respiratory stimulant drugs, oxygen therapy, mechanical ventilation, so placing the patient on a ventilator, and frequent analysis of blood gases. Remember, blood gases we talked about before is when we draw a sample out of the artery, and it will give us a more defined look at the patient's oxygen levels, carbon dioxide levels, the pH balance, or the acidity level of their blood. And it will allow us to take a closer look at the patient's status and treat them accordingly. Hypoxemia is a decreased arterial oxygen level in the blood. So again, when we check the arterial blood, there is a decreased level of oxygen within that blood. Some early signs and symptoms of hypoxemia include restlessness, anxiety, tachypnea or an increased respiratory rate, and tachycardia or an increased heart rate. Some late signs and symptoms include bradycardia or a low heart rate, extreme restlessness, and dyspnea or difficulty breathing. Some causes of hypoxemia include increased work of breathing, a blocked airway, anemia, heart disease, pneumonia, pneumothorax, sleep apnea, and high altitudes. Some nursing interventions and treatments include taking vital signs, specifically checking the oxygen saturation, some calming techniques such as some deep breathing exercises, the Heimlich maneuver. For example, if the patient did have an obstructive airway from some food they were choking on, we would want to perform the Heimlich maneuver to remove that food from their airway. And obviously, at this point, if the patient did become unconscious, we would want to notify a physician immediately. As far as treatments and interventions that we would do, it all depends on what the underlying cause is. But we would most likely apply oxygen, decrease their anxiety, and obviously remove that obstruction from the airway if they were choking. We're now moving on to hypoventilation. Hypoventilation is the inadequate ventilation to meet the body's demand. Some signs and symptoms of hypoventilation, so meaning not getting enough oxygen or a lack of breathing, includes dizziness, occipital headaches, which is a headache at the back of the head, lethargy or severe fatigue and tiredness, disorientation, decreased ability to follow directions, cardiac dysrhythmias, electrolyte imbalances, convulsions, coma, and cardiac arrest. As far as the treatment and nursing interventions, we would want to treat the underlying cause, so we need to find out what is causing this hypoventilation and treat it accordingly. Overall, our goals would be to improve tissue oxygenation, restore ventilation, and achieve an acid-base balance, meaning when we draw that arterial blood gas, we want our oxygen levels, our pH level or the acid level of our blood, as well as our carbon dioxide levels to be within normal ranges. Again, nursing interventions would all depend on the underlying cause of the hypoventilation. Hyperventilation occurs when there is an increase in one's respiratory rate, resulting in an excess amount of carbon dioxide being eliminated. Some signs and symptoms of hyperventilation include tachycardia or an increased heart rate, shortness of breath, chest pain, dizziness, lightheadedness, decreased concentration, paresthesia, extremity numbness, blurred vision, and disorientation. Some causes of hyperventilation include severe anxiety, infection, a head injury, medications, or an acid-base imbalance. The treatments for hyperventilation would be to treat the underlying cause. Again, as with hypoventilation, we want to improve tissue oxygenation, restore ventilation. We would want to reduce the patient's respiratory rate and achieve that acid-base balance or the normal values of the pH level, CO2, and oxygen levels. The nursing interventions, again, would all